Hello and welcome. I'm Mike Larson, President and CEO of the Michigan Association of United Ways, and I want to welcome our viewers to the Michigan Association of United Ways Leadership Talk Series. This is our second, and I'm really excited about our guest speaker. Before I get to our guest speaker, I just want to let folks know that one of the best parts of my job is working with 36 local United Ways across the state of Michigan that are focused on the education, financial stability, and health and basic needs of residents in Michigan, across Michigan. And the work that they do is so important at a local level, but as well as a statewide level. And the partnerships that they create and form in local communities has great impact. I want to, and this is the opportunity for me to connect with statewide leaders in our leadership talks to talk about their work and their alignment in partnership in the work that we do at United Way, and to highlight the opportunities and the challenges that exist in this work and how we can work together to address those issues. So I'm really excited to introduce Chief Deputy Director for Opportunity at the Michigan Department of Health and Human Services, Mr. Lewis Roubal. Lou, thank you so much for joining us today, and welcome. I first off, I want to say thank you for being an ALICE champion. Truly, you are an ALICE champion. We're grateful for the leadership that you provide in supporting individuals and families across our state. But I want to give you an opportunity to introduce yourself and the work that you do at the state.
Hi, Mike. Glad to be with you today. Certainly appreciate the opportunity to talk with you, and really just want to thank you and United Way and the partners that you work with for being good partners in this important work. When I look at the benefits of ALICE, it provides input, and frankly, from folks in my chairs around the nation, we know that part of what allows us to make good, sound choices is by having information available to us, and reports such as ALICE help us do that. The more informed we are, the better we can be at this work, and hopefully the better the residents of our great state of Michigan are as a result. So always happy to chat with you about ALICE, always happy to engage with United Way, as our missions are one of great complement to one another, and with that is great synergies.
Yeah, great. Thank you. And for our viewers that might not know what the acronym stands for in ALICE, it stands for Assets Limited, Income Constrained, Employed. And we're talking really about our working poor. Our people are working sometimes two jobs trying to make ends meet, but struggle to pay the bills each and every day. In our most recent report, it recognizes that 38% of households in Michigan struggle to make ends meet. So when we talk about ALICE, I wanted you to connect you with that. But what we're going to spend a little bit more time specifically today is talking about the new ALICE in Focus, the children's brief that just recently came out. And this is not about households, but this is specifically directed on individuals. And what the report tells us is that 44% of our children in Michigan are in households that struggle to make ends meet each and every day. That's over 960,000 children in our state that struggle. And I know this is a big concern in the work that you do, Lou, and I'm really interested on understanding what this means, what that data means to you and the state and the work that you're doing.
Yeah, sure. And so, Mike, in my world, I have the privilege of working in a couple of different environments that really kind of makes this report incredibly helpful. I work with our child welfare administration and that team, and so for folks who might not be steeped in this, that includes, our child protective services investigations, when we need to remove children from homes and place them in foster care, ultimately looking at permanency for some of those youth through, adoption or reunification, that body of work is part of the portfolio that I get to work with. In addition, our needs-based assistance programs, commonly medical assurance, Medicaid, food assistance or SNAP at the federal levels, our TANF programs, which is referred in Michigan to the Family Independence Program or cash assistance, as well as some of our crisis response programs, which is LIHEAP, when individuals are faced with a electric or heat shutoff, those type of programs, as well as child support and some others fall within my realm here at the department. The reality is we can't look at one side of this work without the other. And so when we know that we have households that are struggling to make ends meet, there is risk in that household. We know that stress levels rise. We know that there is a correlation between those type of housing experiences that can occur, as well as those things then making a family more at risk for there being a child protective services investigation, for instance. We know that nationally, the research shows that the better we are with connecting low-income families to resources, the less likely they're at risk of having potentially a removal and a youth being placed in foster care. We also know that when we look at child maltreatment, something as simple as connecting to the child care program, daycare, has a substantial impact on reducing the likelihood of maltreatment for families that often fall within our ALICE definition. So, Mike, really, I think the reality is often we look at this conversation from a standpoint of just kind of like income and outgo of a balance sheet of a low-income family. I feel that there is so much additional impact when we look at maltreatment, child maltreatment, that really kind of helps round out this issue and really kind of underscore, truly why this is important to every Michigander, regardless of what our individual income circumstance in our household may be. So when we look at our neighbors across the state, from shore to beautiful shore, what can we do to make sure that all children have kind of that start that we, so desperately want and benefits us, for years to come?
Yeah, I think that's a great point. The reality is when we lift up all children to be successful, we lift up all families to be successful, it impacts us all in a positive way. And I really like the thought, because so much of your work is, what I look at is almost like a wraparound. It's not just one thing. We know that families in need that are struggling typically have multiple challenges that they're facing. And how do we create support systems that lift them in all those areas? And you talked about that work. It's interesting. We work very closely with 211 across the state of Michigan and United Way. And that is another connector to real-time services for individuals, especially our ALICE population, for our children. And I know that that's also a partner with the state of Michigan in the work that we do too. I don't know if you might want to just talk a little bit about that relationship.
Yeah, absolutely. So, Mike, one of the things that I have certainly learned in my role is there is resources out there that are absolutely available to help families that are in need, in a wide array of resources. But the reality is those resources are not helpful unless families who are in need of them can find them. And 211 fills that void for us in this state, and is really something that needs to be showcased, because a call to 211 or a visit to the website can quickly provide options to families that are struggling with a range of needs. And I don't want to even pretend to be able to name all of it, but some very unique needs. Low-income family who maybe needs some help with diapers for a newborn, or something a little bit outside of the ordinary. With a quick call can likely get connected to a resource or two that's close to them to have that need met, which is really helpful. And so one of the things that I really hope that the listeners today take away is the power of 211 in connecting solutions to individuals that are experiencing problems. We certainly value it with the department. We hear lots of great feedback. We really appreciate the level of customer service that 211 provides. It's a very well-run call experience. And with that is very helpful in getting to root cause and really helping connect individuals with needs to resources that can help meet those.
Yeah, thank you for that. One thing that I recognize in my 30 years with United Way is one single organization doesn't solve issues. It's how we come together collectively. And we think about that at a community level, but the same way at a state level. It takes how really a collective approach to how we bring our assets and resources together to address issues. So I'm grateful for the work that you do in partnership, whether it's 211 United Way, any other organization that's focused on helping families in need. So, I what I do know about you is you're an innovator. You think strategically to address issues, and I'm always interested, especially in when you go back. These past 2.5 years have been unprecedented. I could have never predicted how when what would happen in this situation, but I do know that Alice families are now impacted even at a greater level than ever. When you think of the inflation and the cost of gas and trying to pay to get to work and keep a job and those types of things, it's just only been magnified. I'm interested from your perspective, what you're seeing are going to be some of the challenges that are in the future for us as we look forward, but also what are the opportunities that you see uh, attached to that we could really focus on to impact?
Yeah, great question. And let me just first start by reiterating what you said. Certainly no one agency or no one entity has the solutions. And so one of the things I think that is a long-term benefit of this pandemic road that we've all traveled together is really the benefit of strengthened relationships. I know the department has worked, closely, for instance, with the Michigan Department of Ed to administer the pandemic EBT program, which has helped out, literally hundreds of thousands of children and families across the state who otherwise would have been receiving, free and reduced lunch during the school day during the pandemic. Those relationships that we have formed will last long after the pandemic has ended. In addition, the work that we've done with MISHDA, the work that we've done with the Michigan Public Services Commission and the large utility providers, on and on and on, the work that we've done with United Way 211. So, as far as some of the things that I get excited about, it's the fact that, we've made it through this journey. And with that, we're going to take a lot of the learnings and the benefits forward into, solving complex problems into the future. So it really kind of, I think, jump-started all of us and really kind of brought the best of these different organizations, entities, and departments together. This work is exciting. Now, as far as the challenges that we know that Alice families are facing, there is many. Ultimately at the department level, as we look at social determinants of health strategies, we know that housing is at the top of that list, as is food security. Everybody who runs through the checkout line at their local grocer knows that the cost of groceries is going up. We have, I think, with the help of our federal partners, been able to do some things to help that for our low-income families. In March of 2022, we were able to issue about $320 million of SNAP benefits. Those are the traditional benefits, as well as emergency allotments, which are contingent upon the public health emergency. Mike, just to put that in perspective, if we were to go back 2 years, we were at 135 million. So, we're looking at a 2.5-fold increase there. Now, those benefits won't stay at that level forever. There is, the contingency as the pandemic winds down, those benefits will reduce to, their typical levels. We do know that we're carrying about 13% more cases than we were pre-pandemic. And so, with that, I think the question is, employment, what does that look like? And employment mobility. So, one of the things that is really, I think, important to underscore is, the incredible work that's being done by the Michigan Department of Education around the child daycare program. As we work with families, we know that, daycare is often at the top of the list for, a potential barrier to employment. And, as a dad myself, I know that, daycare is an incredibly important resource, and finding the daycare that meets the need of, your particular family based on work shifts and age of children and needs of children, et cetera. So one of the things I think that we know is we have a lot of investment going into the daycare program right now, which should certainly be helpful. The other challenge that we often hear about is transportation. Transportation, is one that is interesting, because if you talk to, folks in the rural community, they certainly point out, the challenges with transportation, but it's not just limited to rural communities. Plenty of our urban areas of the state, we need transportation solutions. So, that also is a reality to our Alice households, that, we collectively need to work towards solutions around. So, a couple of real tangible issues there that hopefully we can work to resolve, on top of just kind of that ongoing challenge of whatever, the unique circumstances of the household. We know that there's a number of Alice households that can face heat and electric shutoffs. So, is there things that we can do to help, eligible households resolve those with as little administrative burden as possible? Because what we want to do is hopefully keep the stress level in homes down. That allows, mom and dad to go to work and continue and not have to take off too much time from work to have, that emergency resolved. Because if not, there's a cycle that families can fall into. If I have to take off time to work to take care of issue one, well, then my income just decreased for the following month, or maybe I have a risk of employment loss, which certainly can manifest into, even larger problems in future months. So, Mike, this is certainly a complicated network of issues, but one that I am really kind of highly encouraged that we are better positioned today to take on as a state to help out, our neighbors and residents than we have been before.
Yeah, I would agree. I've been amazed at the response that we've seen across the state to address some of these issues. And we've been fortunate to have some resources that we've not had in the past that's helped with that. But and understanding that those aren't going to always be there, but we're also strategically investing in resources to build the infrastructure to support people as we move out of having the money available. And I think that's going to be key, is being very thoughtful on how we build the infrastructure that really supports families as we move forward. But it's even things like that we're really pushing right now around the earned income tax credit. We know how that it plays such a huge role for families in need that are working, and it's an incentive for them to work. All of those things, and it's a benefit in our communities. But I think those are long-term type of impact solutions that we need to continue to drive. But totally understand and appreciate the challenge that you're seeing. I think another thing that stands out that we see in local communities from United Way is affordable, quality childcare. And it's just finding. I mean, you think about the challenges of keeping childcare providers employed. Their wages are low. It's hard to find people. And then also think about trying to find these organizations that are open at different times where it works with people's work schedules. So all of those things sometimes we don't think about, but that's a reality that families are challenged with each and every day. One other area I wanted to just kind of mention out of the children's report was, we know that we've got some real disparities, especially around children of color. And, one area that stood out to me that really frustrates but recognizes the need of focus is that 71% of our Black children and 58% of our Hispanic children live in households that are below the Alice threshold. That's huge. And that creates a real challenge for them and barriers for them to overcome to be successful. I'm very interested in kind of your thoughts and perspective on that.
Yeah, absolutely, Mike. And, the point is well taken, right? We want all Michigan children to have kind of that stable family, if you will, that can be successful moving forward. And so, what do we do then to try to cultivate that? I can tell you kind of internal to the department, how are we equitable and inclusive, and support and diversity is incredibly important. And so, part of that comes down to how do we do business and what are the tools that engage with residents and how do those work across, the different populations in the state. So, we are putting those to grind, if you will, to make sure that, we are as inclusive as we can be. This has really allowed us to take a hard look in the mirror at some of the things that we've done. We certainly are interested in looking at our policies to make sure that those are not providing kind of undue administrative barriers to certain segments of the population, and have learned some things there and have improved some things. I think in general, our benefit access is incredibly important, right? So when we are engaging with resident families, are we able to do so for families that may not have English as their primary language, as an example? Are we able to accommodate the reality that, not everybody is as fluent in English, Mike, as you or I, or maybe not everybody is as good on the computer as you and I may be. So, how do we make sure that we have kind of the broad basic needs covered? The department has certainly done some work to really kind of better engage residents that are seeking assistance from us. We have gone through and fully redesigned our application for benefit assistance. It was an outlier across the nation with kind of how complicated it was and how hard it was to understand. And this wasn't only a burden for our neighbors in Michigan that were, needing a little bit of help, but it was also a burden for us internally because, it was problematic for our eligibility workers to understand what was going on in the family circumstance because of the complexity and the way we ask questions, et cetera. So we really streamlined that. We've done the same with our online application, which is available in Arabic and Spanish, as well as English. And we believe provides a lot better resident experience, which then allows us to be more efficient with how we are able to engage and interact with residents. So, we certainly have taken away some learnings. It's something that is a journey. It's something that, we learn more about. We look at, how do our policies impact different, racial groups? How do our policies impact, individuals that may not be English speaking? And what can we do to address those things? Because, like you had mentioned earlier, we really want a system that can help raise everyone and doesn't leave, certain communities, if you will, on the margins or the fringes.
Absolutely. And I want to commend you with the changes you have made. I mean, they're significant. We and local communities hear that. And just the application process was one of the biggest changes and improvements that you guys have made in years. And we have barriers that people struggle with to get access to services, and things like that can easily become a barrier. And the more we can remove barriers and make it easy to connect them to the services they're eligible for, we need to do that. And I'm so thankful for the changes that you guys have stepped up and made there. Well, as I look at the time, I think we're getting about that time where we have to close out. Lou, is there anything else that you might want to highlight or mention, in our conversation about children in the Alice report? And also, if there's things that I always love to put it out, or what can United Way be doing more of that really helps and supports your work and also helps Alice?
Well, Mike, first of all, I appreciate the partnership that United Way has, with us. So you guys are always there when we need help. I think that you're always open to feedback. You're always open for system improvement, and you're always open to share things that we need to know. And maybe at times are not easy to hear. So I ask that you guys do more of that and you continue to do what you've been doing. That's excellent. As far as kind of in general, the things that I always want to make sure are out there is, our Alice families are families that can use a hand up at times. And so when we have opportunities to help connect them to resources in a dignified, efficient manner, we need to do that regardless of what specific chairs we sit in. Super thankful for the partnerships we have with so many entities, both public, private, community-based organizations, and really just kind of want to continue to cultivate that and want to continue to encourage folks to reach out to us if they think that we're helpful. We're trying to do work around cross-enrollment where we identify kind of proactive proactively family needs and get them connected to resources. So again, to kind of reduce that administrative burden. And in addition, in the child welfare world, we're constantly looking at how do we work upstream. So, we don't have children facing maltreatment events and becoming victims, but really working on more of a preventative manner. And I would be remiss, Mike, if I didn't put a plug out there for, our foster parents that really kind of are the heart and soul of, just an absolutely essential part of the child welfare system. We certainly don't want to see children have to be removed from homes, but in those, kind of most unique and perilous situations that they do need to, our foster parents are really, just incredible people. And so, regardless of what chair we sit in, if there's a way in your role that you can support a foster parent or help make potential foster parents aware of the enrollment process, I really think that there's a big plug there, because the stronger our foster care system is, then the quicker we can get kids reunited with mom and dad and get permanency for children. So a few things there, Mike, but really just wanted to end by expressing my appreciation for the partnership with United Way. Really are thankful for the work you guys do.
Wow, absolutely. Well, I want to thank you personally for taking the time to join us today and give the viewers a chance to hear a perspective that most people don't. And on a personal standpoint, thank you for being a champion of families in need. I know you do this work because you have a true heart for it. And I'm grateful for leaders at the state level that bring that level of commitment and passion to supporting our families in Michigan. That's just so important. So thank you for the time. And again, I want to thank our viewers for joining us today. And if you'd like to learn more about the Allison Focus Children's Report, you can go to www.michiganalice.org. And there's so much data there, actually different dashboards. You can pull information differently. You can get it down to a community level to better understand those needs just in your community. I really encourage you to go and visit the site again. It's michiganalice.org. Take advantage of that. So thank you everybody for joining today. Have a wonderful day, and we'll look forward to our next leadership talk series here in the near future. Take care.